Yeah, normal is not optimal is kind of our mantra. Um, in a lot of cases, it's referring to lab work. So the numbers that we see reported for a patient's, hormone levels. And the most common scenario is that a patient will be experiencing some symptoms, like I hear all the time, I don't know if it's that my hormones are off or if I'm just getting older. Because a lot of these symptoms we tend to associate with aging. Things like a little bit of weight gain and some fatigue and some brain fog and some sleep disruption and a little bit of, depression. Um, Sometimes patients and providers would call that, normal for your age. Another thing that we hear, maybe especially for women, is, well, you have all of these symptoms because you're in your 40s, or because you have 3 kids, or because you're a busy professional, or maybe you're all of those things. And so being tired makes sense. Welcome to midlife, right? And this is the implication of those types of explanations is that there's nothing that can be done. And that is not true. So when we look at lab values, a couple of things warrant some consideration. What people notice on their labs is that the lab will have something called a reference range, a normal range, right? And um, the first question that should come to mind is, well, where does that normal range come from? Who gets to decide what is normal? And the way that the lab does this is they'll take a random sampling of a population. For instance, we can use as an example TSH, thyroid stimulating hormone, right? It's a screening test for thyroid disorders. And they'll study or they'll collect 5,000 TSHs, and then they'll find what the average is, sometimes called the mean. And then we'll go 2 standard deviations outside of that to create a bell curve. The bell curve is by design intended to include 95% of the population. So your thyroid test would have to be a huge outlier, like 2.5% on either end, for your labs to even be flagged as abnormal. Also consider what types of people get their labs drawn the most often, meaning who is most represented in this random sampling of the population. And if you think about it, it's going to be mostly people who are older and sicker. And that is also going to skew those normal reference ranges to be lower than they would otherwise. Because if we were smart about this, we would go study 10,000 healthy 20-year-olds and find out what their thyroid function looks like, and then match everybody to that healthy young person. Instead, we do the opposite. We study older and sicker people, and they set the standard for what is considered normal. So this is a very important distinction and a different mindset of the provider who is assessing those labs. Truly, 90+% of my patients have normal lab values, but that doesn't mean that they don't have symptoms, and it doesn't mean that they can't get or feel better and benefit from optimization.